Hello, everybody. Welcome to the Virginia Department of Health Town Hall meeting. And I'm Dr. Lynam. I'm a board certified anesthesiologist. I'm a local Richmond girl, been practicing for about 18 years. And with me is Dr. Tiffany Kimbrough, who we met on Facebook, because during this pandemic, that's kind of the place to meet people. And we are really excited about this project. We want to educate parents with the latest information in a very just low stress type of way, no pressure, but we want to really try to get rid of a lot of that disinformation that's out there. So you as a parent, as a member of your family can make a wise decision for yourself, what's right for you. But we definitely want those decisions to be based in fact. And so we're going to go over some data. So delighted that we have a pediatrician with us, and she is the medical director of the mother infant unit at VCU. So she really knows her stuff. And we actually met because she found a post I made about entering our children into the research trials. And so as we move into the meat of this and we talk about the vaccination of the 5 to 11-year-olds, which we do suspect will be the next age group that will get EUA, just know that a lot of these trials, a lot of the adults are physicians that have signed up for these trials, and a lot of the children are physician children as well. And so it's kind of like, we see the suffering, we are really worried about our children and the potential long haul effects. And we've kind of put our children in the lifeboat, so to speak, the first lifeboat that came around. So in an ideal world that your physician, your pediatrician would be able to spend time with you at a visit one-on-one and just spend 5 minutes and answer all your questions. And that is not ideal because you've got lots of other topics to cover during even just a well visit or a sick visit, so that it doesn't always happen. So this is kind of a compromise, and we hope that you'll listen to us as physicians with lots of years of training. We're members of your community, and probably most importantly, we're moms. So we would do anything to protect our children. Our first slide here is just the topic of the 5 things that parents need to know about the COVID-19 vaccine. And we're so fortunate to have a pediatrician. Oh, and also I'm wearing a crown. I was Dr. Virginia 2020, and I am now Dr. United States of America. And my platform is COVID-19 education, if you can't tell. So what we're going to go over today is the latest statistics, because they have definitely changed. And we're going to talk about the current statistics in the children, the metrics, like how many kids are getting infected. What we're seeing is the percentage of younger people getting COVID-19 infections. It's getting younger because that's sort of the patient population that is no longer, that's unvaccinated. So the virus has got to go somewhere, and it's much more infectious, and this is the group that's vulnerable. So we'll talk about how COVID-19 is impacting children in many ways. And so here's our first graph about what's happening in Virginia. So you can look back, the blue is the confirmed cases, the red is the probable cases, and the yellow line is the 7-day moving average. So you can see that the vaccines came out to the public in April, and we were doing pretty well in May. Our numbers weren't that bad. But then unfortunately, the Delta variant emerged. And what we were seeing is a large number of people, particularly the unvaccinated, starting to get sick. And the percentage of, as I said, the people getting sick are trending younger, because a lot of the people in the 70s and 80 age groups are vaccinated. And Delta is just so much more contagious. Our ancestral strain had an R0 of about 2, and the Delta has an R0 of about 8. And what R0 is if I get infected, on average, if I have Delta, I'm likely to infect 8 different people. So that's pretty bad. That's approaching measles and chickenpox. So it's really infectious. It's mutated such that the spike proteins are like super glue, whereas it's sticking to our cells, whereas the ancestral strain was just like in maple syrup. And the viral load that the researchers are seeing on the back of people's throats are just 1,000-fold higher. So that's probably the explanation for why we see this graph just shooting up like it is in July and August. We'll go to the next slide. All right, so here's some of the most updated numbers for children. They make up 14.4% of all COVID-19 cases right now, which is very different from a year ago. This includes over 4 million total cases of COVID-19 children cases. The overall rate for pediatric COVID-19 cases is about almost 6,000 per 100,000 children. These child COVID-19 cases are not slowing down at all, especially with school opening up. These kids are going to have a lot more contact. So we all fear these numbers are going to go up. So I think September will continue that upward trend that we've seen in August. Children make up 18% of the cases reported in the week of August 5th to August 12th. In addition, over a 2-week period, there was a 5% increase in children pediatric COVID-19 cases from 729 to 812. And I think we'll let Dr. Kimbrough start touching on the meat of the program here.
So Dr. Kimbrough again, I'm excited to be here, and just thank you, Dr. Lynam, for that great intro. So how is COVID-19 impacting children? We know that COVID-19 has impacted kids in so many ways this last year, from their educational, social, and physical activities. But we also know that kids who actually develop COVID-19 develop illness, and that leads to cardiac, respiratory, or lung involvement, neurodevelopmental issues, and sometimes even psychiatric. So we're seeing kids that really have multiple organs impacted by COVID-19. You may have heard in the news that it's just a cold, but for a lot of kids, that's not the case. It's important to note that it also can affect mental health and stress, just as kids worry about, have I infected anyone else? Do I have to miss school for 2 weeks or miss activities or be separated from family members who may be vulnerable? The best way to combat these issues in children is to prevent COVID-19 in any way possible. And one of those tools in our toolkit really is the vaccine. The COVID-19 vaccine can help children stay focused on what's important and essentially help kids, be in school, and live their lives.
That's so important.
Yeah. Next slide, Caroline.
I know you've probably heard anecdotal stories of children who are athletes and they've not been able to return to that peak level of performance even months later.
Absolutely. So here's the 5 things that we want you to take away from this talk. The benefits of the vaccines, first of all, far outweighed any potential risks. The CDC and the AAP, the American Academy of Pediatrics, recommend COVID-19 vaccination for everyone 12 years of age and older. And we know that EUA, as Dr. Lynam mentioned, for the younger age group, for age 5 to 11, is just on the horizon. So we're expecting, hopefully by the end of September into October, that may be coming. So number one of the questions we hear from families is, can my child get COVID-19 from the vaccine? And the answer to that is no. There is no live or attenuated virus in the vaccines. The second thing we hear was the vaccine rushed, or what are the standards that had to be met? And these vaccines followed all previously established standards for development of all 3 of the products, so Pfizer, Moderna, and J&J. And the products that we have available right now for children down to 12 is the Pfizer vaccine. The third thing that we wanted to hit on is that the COVID-19 vaccines help protect health. So that keeps kids healthy and in school, so they aren't at home having to quarantine if they get sick, and also helps prevent hospitalizations and ultimately death. The vaccines are 0 out-of-pocket costs, 0.4, so there's no charge to families to receive the COVID-19 vaccines. And number 5, it's also important to note that some businesses, travel, restaurants even, are starting to require vaccination. So by being vaccinated, you allow your kid to participate in all their usual activities, be able to attend school, be able to travel, and then participate in those activities which may start to require vaccination. Next slide. So what are some common myths that we're hearing? And we get a lot of questions because there's so much circulating on social media, and it can be really hard to parse through all of that. One of the most common things, especially for my female patients, is that folks are worried about, will vaccines cause fertility issues or make it difficult to get pregnant later on? And there have been several studies published that have debunked this myth. And the Society for Reproductive Medicine has actually come out with a position statement encouraging all eligible females to become vaccinated, that they are supporting this and there's no risk for long-term fertility issues. Another question that we hear, or myth, is that the vaccines can make kids really sick. The complication rates are too high. It's just not safe. And it's important to note that there are adverse reactions expected. We expect kids may have muscle aches or low-grade temperatures, but these vaccines have been studied and are safe and effective. Another question that I hear from families is, will the vaccine affect my child's DNA? And the answer to that is unequivocally no. There is no interaction with the DNA whatsoever. This is not interfacing with your child's DNA. The mRNA that's introduced is excreted rapidly and in no way touches the inside of the cell or the nucleus where the DNA is housed. Some other folks have heard that getting the vaccine will make your child more susceptible to the virus, and that is also not true. The vaccine utilizes your body's immune system to help train it for how to fight off the infection, but it does not weaken your immune system in any way. And another thing that I've heard folks say is that if I choose not to get vaccinated, it only affects me. So it's not really that big of a deal. It's my choice. And we all know that we live in the communities that we live in. And so all of our choices impact one another. And one of the ways that you can not only keep yourself and your family healthy, but also keep those around you healthy is by choosing to get vaccinated. Next slide. So Dr. Lynam and I are going to hit some of these frequently asked questions, and then we were lucky enough to get some questions ahead of time from audience participants, so we'll also go through those. The first question, Dr. Lynam, do you want to take this one? What ages are allowed to get the current COVID-19 vaccines?
Sure. So we all had the exciting news on Monday that there was full approval from the FDA. That is from 16 and up. The 12 age group, they are still getting vaccinated under EUA. And I have a little bit of inside information just from being a trial participant myself and having all three of my daughters in the trials. What it looks like is the 5 to 11 group, at least, and I'm still talking about Pfizer because Moderna somehow has gotten a little slow start out of the gate for their pediatric trials. But the 5 to 11 vaccine, I would expect weeks, maybe a couple months at most, based on just the fact that my daughter got her vaccine back in June. So hopefully they will have enough data and they just know how important it is to get that out. The FDA, I believe, asked Pfizer for more children to be studied in the other two cohorts, the 6 months to 2 year and the 2 to 4 year old age group. So up until like a couple of weeks ago, I was helping plug parents into those studies. I believe the rumor I heard is that Pfizer has filled nationwide all the spots for those younger children, but still they need time to actually get those appointments, get those vaccines in, and carefully study those children. So I would imagine it'll be later in the year for the younger ones. But I'm really excited that the school-age children are on the cusp of getting access to that vaccine, because we all want them not just to be healthy, but we want them to stay in school. And, we all know how hard this past year has been. I myself had a virtual student and it's rough.
Absolutely.
I like the question about where can we get vaccinated? Can you answer that?
Yeah. So your child's pediatrician office most likely is providing this vaccination. So we encourage you to call your pediatrician or family medicine doctor. If you're not sure, you can also visit vaccinate.virginia.gov and find a vaccination site and schedule your appointment.
And if I came to see you with my child and I was not vaccinated, would you be able to offer me a vaccine?
Absolutely. So we are vaccinating parents in our office.
That's super. That's great. And do you think, as a pediatrician, that a child needs a vaccine even if they're, in theory, not going to get very sick from COVID-19?
This is a great question, and one that really gets at, what is my child's individual risk? And we know that most kids luckily do very well, but unfortunately that's not the case for everyone. So we know there have been over 18,000 pediatric hospitalizations so far, and as you may have seen in the news, that rate is going up. So we're seeing more kids ending up in the hospital. We also know that over 300 children have unfortunately passed away so far from COVID-19, and not all of them have underlying health issues. And then lastly, we're seeing more of the multi-inflammatory syndrome, MIS, as you may have seen. And that's a complication that can happen a few weeks after COVID, where kids get very sick and end up in the hospital. And so all of these are reasons that we recommend your child to get the COVID-19 vaccine. What about,
how sick do you think the children get after getting vaccinated? In my case study of one, my 7-year-old had very, very mild symptoms. In fact, I was like, does your arm hurt? Does your arm hurt? And she said, yeah, but this one hurts too. So compared to myself and my husband and grandma and my teenagers, her symptoms were very, very mild. And I don't know for sure she wasn't in the placebo group, but she did get a little bit of a temperature. So I'm pretty convinced that we were in the vaccine arm. But
that's a great question. We expect, as listed on the package inserts, there's a chance for that arm soreness that your child may have experienced, Dr. Lynam, some muscle aches, headache, low-grade temperatures, just feeling run down, wanting to lay on the sofa even more than sometimes they already do. And if they do have any of those symptoms, it tends to be no longer than 1 to 3 days, controlled by fluids and pain-reducing medications. And there's some data that actually looks like kids experience those symptoms less than we did. I know I had kind of that arm soreness, headache after my my second dose, but that kids may actually be spared compared to us with some of those symptoms.
In fact, I had a hard time keeping her still. She was just because you don't know, as many months ago, we were the first ones. And I was like, well, just take it easy, stay in bed. No, she was bouncing off the walls. Wanted to go to the pool. So,
well, what about Dr. Lynam? What is the Delta variant? Can you walk us through what that is? I know you mentioned it a little bit earlier.
Definitely. So, viruses, these RNA viruses multiply in just huge numbers. And it's kind of like copying a key at the hardware store. Every time you copy a key and a copy of a copy of a copy of a copy, little mistakes happen. And for the most part, a mutation in a virus is not going to help it. It's going to be a mistake, and it's just going to, that virus is going to die. But if it, odds are you play the lottery enough time, it's going to make a key that's actually going to stick better than the original key. And that's what we found with Delta. Like I mentioned before, it's like super glue to our cells. And the viral load that we're catching is much, much higher on the mucosa. And the thing about the vaccine is that it's really great at creating IgG, where that's when the virus gets in your body, it just boom, boom, knocks it out and kills it, but not so great at IgA, since we don't have a flu mist type equivalent. So the vaccinated people are still at risk of getting colonized, if you would, with the Delta variant, because that R naught is so high. That's really my big concern. And so that's kind of why we're sort of pushing back towards the masking, because, I may get infected and not even know it, and I could pass it on to someone who's not able to get vaccinated, or someone who can get vaccinated and doesn't mount a good antibody response. So back to my mask protecting you type of thing.
We're all in this together.
Yes, definitely. And hopefully there's no more variants after this, that we're done. And I know some are trying to pop up, but hopefully we can squash this one and get back to normal very soon.
Absolutely. Do you want to touch on the timeline? Do you think the vaccines were made too quickly?
Oh, definitely not. So, my dad was an MD, PhD. I love research. I went to a research-oriented college. And the difference here is that, number one, it's like you have a homework project, and basically the entire school said, I'm going to help you on that homework project. So rather than one little department with 5 people, you've now just got thousands of people working on this one homework project, and the whole world is working on it, because we're all facing this same problem, and you've got the brightest minds who are maybe working on some little pet project, like they drop what they were doing. The all the phases of study were done, but sometimes they were done concurrently. So they might have already started making the vaccine while they were still testing it. So when the data came, there wasn't this lag. And also, because going back to R naught, back when the trial started with the ancestral strain, the R naught was much lower, but it was still pretty bad. So a lot of people were getting sick. So those of us in the original Pfizer adult trial, a lot of people in the placebo arm got sick very quickly because it was just spreading so quickly. If it was something really rare like Ebola, you wouldn't get that data that quickly. So I don't think it was rushed. And because, we're also, fearful of our own safety and our family safety, a lot of volunteers like myself stepped up to the plate. So, all the stars aligned. And I think Pfizer actually on Monday, when they dropped off for full approval, there was 300,000 pages in the document. That's, can you imagine writing a research paper that had 300,000 pages in it? So yeah, I don't think they skipped anything.
Yeah, I was so encouraged by all of that and the fact that, mRNA technology had been around for, almost 20 years prior to the pandemic. So we already had all those great building blocks to just take off and be able to almost start ahead of the game in some ways. So I agree with you. And that's what I've been also sharing with my patients is there really haven't been steps to this that were rushed or that were missed or that we, threw safety away at the expense of getting something quickly.
Definitely.
So I know we have had a couple of questions that we got ahead of time. One of those
they're talking about the myocarditis.
Yeah.
People have some concerns about
Absolutely. And I think that's been in the headlines a lot. So a lot of families have had questions about that. So if you haven't heard, myocarditis is inflammation of the muscle of the heart. And that's something that can commonly happen from viruses themselves. They can actually cause that heart inflammation. And some common symptoms are, mild chest pain, kind of feeling lightheaded, feeling short of breath. So those are things that we can sometimes see from viral-induced myocarditis. What they saw after the 16 and up age group began to be able to get vaccinated is that there were some additional reports of myocarditis coming out after the vaccine. And that's one of the reasons why it's so important for us to have post-marketing surveillance is what we call it, or how we make sure that vaccines are safe after they get rolled out to such a large scale. And so everyone took a pause to look and see what was going on with myocarditis for kids. And they found a very low and rare chance of myocarditis. And the rate that we've found for kids 12 and up is roughly on the order of 12 per 1 million doses. So again, incredibly rare. We actually see myocarditis happen from COVID itself into a much greater magnitude than what we expect to see from the vaccine. So this is one of those things that you want to make sure that you're having conversations with your healthcare provider about. But again, it is incredibly rare. We see it more often in males and more often in males who are 16 and older. But again, even for those males, much less from the vaccine than from COVID-19 disease itself.
What's the typical scenario for someone who gets myocarditis from the vaccine? Are they winding up in the hospital or is it just managed at home?
Most of these cases are managed at home just with anti-inflammatories like Motrin, and these kids get better within a couple of days. Usually symptoms start within a week of their second dose is what we're most commonly seeing. But again, most cases are mild and self-resolving pretty quickly.
And we're all being so cautious as these children's doctors that, if we're concerned, we're probably pulling troponins that we wouldn't have otherwise pulled from another vaccine or viral illness. And
exactly.
Just catching stuff because we're being so careful.
All eyes are on this. So yeah, I agree with you. I think that there probably is a degree of hypervigilance. We're all just watching so closely to make sure we're not missing anything. So I agree. I think sometimes we're getting labs or getting extra studies that maybe we wouldn't have gotten otherwise. There have been some studies looking at that cardiac involvement question after COVID-19 disease, and as many as 2% of children who are infected with COVID-19 have changes on cardiac MRI. So again, we're just seeing the rate of magnitude, 12 per million versus upwards of 2% looking at that risk benefit.
And are you hearing that the PICUs are getting full and there's a strain on resources, and um, I know in other states it's really getting bad. There's
We
some
are
people.
so blessed so far in that we're seeing increased cases, but not yet a dramatic change in our inpatient stays, so either hospitalizations or ICUs. We're attributing a lot of that to the fact that Virginia has a higher vaccination rate than a lot of these other states. So our adults have really stepped up to the plate to help provide that herd immunity for our kids. And we're hopeful that we'll see that trend continue. But that's another reason why it's just also important that once it's your turn, that you do get vaccinated.
How concerned are you once the kids are now back in school that things are going to change?
Well, I think that's one thing that we are all looking for is over these next couple of weeks as kids are together. But the other infection control measures that are in place are also one of the things that is an important tool in our toolbox. So the importance of masking, hand washing, physical distancing, washing those high touch areas, cohorting where possible, all of those things we know they worked last year. And so we want to keep doing those things while we wait for the vaccine to be approved for our under 12-year-old kiddos.
And that's what we talk about, the Swiss cheese model. I love that analogy that no one method is perfect. We know that. And but when you start layering those stacks of Swiss cheese on top of each other, you can really reduce your risks. And I think the vaccine is probably the slice of cheese with the smallest holes in it. So I'm really excited for that to become available for our children. I know for me as a parent, my mental stress, assuming that my child is vaccinated, is so much lower. And I have so many parents who just were trying to get into the trials and didn't. And they're really concerned about, their children going back to school, but they have to weigh the risks and benefits of in-person learning. And I know lots of people are just can't wait for their turn to make sure that their child has that extra layer of Swiss cheese.
Absolutely. Well, Dr. Lynam and I are going to wrap up. If you are watching this and you have any questions at all, please feel free to drop those in the comments below, and a member from the team will get back with you. If you want to advance the slide, we'll also show you where you can go to get more information. To get more information about available vaccinations or to schedule your appointment. Thank you so much and have a wonderful evening.
Thank you, everybody. Be safe.